Okay, this is a quick in-service on placing an Aspira catheter. We will start with prepping the catheter. The red tag on the end of the catheter kind of tells you exactly what to do. It says flush here. It's talking about the side port. Flush the side port, and it tells you why. A hydrophilic coated stylet, flush to remove. So the stylet in the end of the catheter is hydrophilically coated. If you don't flush that side port, then it's almost impossible to remove this stylet at the end. So remember in prepping the catheter to flush this side port. After that, you're ready to go ahead and attach the tunneler to the end of the catheter. And the tunneler, once it's attached, now you have the catheter prepped and ready to go. To start with, obviously a small nick, and you will begin placing the catheter with an 18 gauge needle that comes in the kit. So you'll gain access to the pocket of fluid. Then at that point you will thread the wire down through the needle to the pocket of fluid and remove the needle over the wire. Now you have the wire in place with access to your pocket of fluid. Second thing, you want to find your exit site for the catheter. They recommend 5 cm. A lot of docs use 3 finger widths. And for a pleural placement, we recommend tunneling inferior and medial. For a peritoneal placement, it would be medial and superior. So anyway, find the distance that you want your tunnel. Go ahead and anesthetize the entire tunnel track. Make your nick for insertion, and we want to just go ahead and tunnel the catheter to the wire. So we tunnel the catheter to the wire as opposed to, I see a lot of docs that want to go ahead and place the sheath over the wire right off the bat. It's really, and it's in the IFU, it's really the best to tunnel to the wire. For one, you don't have that big of an incision here. And so if you already have your sheath in and you're trying to pull this catheter out that same hole that the sheath is in, you're collapsing the sheath sometimes. You're just having a really hard time to pull this thing through. So it's best to go to the wire. The second thing that I've seen a lot is if you tunnel to the sheath, it's easier to have a skin tag in between the sheath and the catheter, which once you press the catheter in, causes the catheter to pinch off. So tunnel to the wire. That's where we are to this point. Then there is a series of 2 dilators that we would run down over the wire. Second dilator over, then we are ready for the sheath itself. So we'll send the sheath over the wire. Now this is a valve sheath, so when you twist and remove the introducer part of the sheath, you can go ahead and pull the wire out and everything with the introducer, leave the sheath in place. The sheath is going to close off so that you don't have fluid running everywhere and don't have to put your thumb over it. Now the end of the catheter, of course, can go down through the sheath. The sheath is a peel-away sheath, so as you press the catheter in place, and because I don't have any saline on it, it makes it a little difficult to press through. And if you're having problems pressing it through, a lot of times it's because the sheath is pinched off a little bit. A little bit of surgical lube or saline is going to help your cause to push this through the sheath. So then, of course, you're going to want to peel away the sheath. The catheter goes further and further in place. And, of course, this is a little more awkward because I'm doing it dry here on a pad. So you'll shove the catheter home as you get closer and as you've peeled away the sheath. So now you'll have the catheter in place. Now we're ready to talk about what comes at the end. This catheter has a stylet in it, and that's why we flushed it to begin with. You're going to have this hub hanging out. You're going to need to remove this stylet. If you don't remove this stylet all the way, it's going to be plugging all the holes in the catheter, and it's not going to allow the catheter to drain. So to remember to remove that stylet. Now you're ready to cut the catheter to length. So we're going to take surgical scissors, cut the hub of the catheter off, and now we will be left with this situation, and this is the valve. As soon as you remove the stylet, you're gonna have fluid flowing out of the end of the catheter. That's what this green clamp is for. After you've removed the stylet, you can go ahead and clamp the catheter off. That'll make the whole process cleaner. You can insert the valve, and now you would be ready to actually test the catheter and drain it. Kit comes with a universal adapter. We'll plug onto the end of the catheter. OR tubing can hook to this and then to wall suction. So you can drain the patient while they're on the table with this. Then as soon as you, of course you don't want this green clamp on. You got to take that green clamp off for the whole thing to flow. Then you take this off and you're ready to kind of do the finishing touches. It has a cap to put over this. You're going to want to suture the initial insertion site and then suture the catheter to hold it in place here. To dress the catheter, we would put split gauze around here. Then we would curl the catheter up on top of the split gauze, put another set of 4x4s over the top of that, and then tegaderm the top of that. And that secures everything for the patient to go home and heal up.